Dan.
All right. Good morning, everyone, and welcome to the Montgomery County Chamber's Economic Development Committee meeting for March 13th. We're very pleased that you could join us. We have a very, I personally and professionally find a very interesting topic and an important topic for Montgomery County, the region, the entire state, the entire country. So I look forward to hearing more about it. Now I want to hand it over to the chair of our Economic Development Committee and the co-chair of our Economic Development Committee, Dr. Ann Kademian and Joan McLaughlin. Ann and Joan, take it away.
Thanks so much. Joan, are you okay if I kick things off?
Please do.
All right, thank you so much. Well, on behalf of my co-chair, Joan McLaughlin, and myself, we are really excited for this conversation today, and we're excited to welcome our two guests, Kimberly Rusnak, who is the Executive Director of the Children's Opportunity Alliance, and also Patricia Ruppert, who is the Vice Chair of the board. And the organization, the Children's Opportunity Alliance, is a fascinating organization that has a tremendous job, huge effort. They were created to help bring together partners across the county to provide high quality, equitable, data-informed care for children ages from birth to age 5 and beyond, because children who can thrive in those early years will continue to thrive as well. And so this, the Children's Opportunity Alliance was designated in, I believe it was July of 2022, was designated to be Montgomery County's early care and education coordinating entity as well. So they serve as an official entity in the county for trying to build this care. This is such a challenge. Child care is such a challenge. Early education is such a challenge. We all, you may be familiar with the report that came out by the Comptroller of the Currency, by Brooke Learman, earlier. It was actually in November of 2023. And the focus on one of the reasons why so many women have yet to return to the workforce after the pandemic is primarily about quality childcare. And so this is a huge challenge for us. It's not a family challenge. It's not a woman's challenge. It's not even just an educational challenge. It is a fundamental economic and workforce development challenge that we all need to figure out how to move this forward. And I want to call out in this effort too the leadership group of Montgomery Moving Forward, who's been so instrumental in moving this effort in the county forward as well, in the designation of the Children's Opportunity Alliance as the county's early care and education coordinating entity. So both Kimberly Rusnak brings tremendous experience to this role, a lot of nonprofit leadership, a lot of work and experience in this broad world of collaboration and coordination, bringing philanthropy together with business, with nonprofit entities to really drive change. And also Pat Ruppert, who is the vice chair of the board of directors, brings a strong and powerful educational background to this as well. So with that, I'm going to kick it off and welcome Kimberly and welcome Pat. We're so grateful to hear from you, and we are recording this. There's a lot of interest in this, so we look forward to also being able to share this conversation with others after today. So take it away.
Well, thank you for those kind words, Anne. We are a new organization. We've been around for just over a year. I'm going to start by sharing my slides here. But as you noted, I'm the executive director. Pat is our vice chair. We have a very interesting 21-member board that is county appointed. But as you talked about very eloquently, we really believe that early care and education is an economic imperative, and that there is a lot of work to be done in our community to expand access. And so, there we go. So as you noted, we are Montgomery County's coordinating entity for early care and education. We are just wrapping up our strategic planning process. And so we have built out this vision and mission, which we'd like to share with you today. Our vision for the future is that every young child in Montgomery County has an equitable start in life, creating a stronger future for all of us. And we really believe our mission is to connect our community together to build an equitable, accessible, high quality, and sustainable early childhood system that narrows disparities and puts all young children on a path to reach their greatest potential. So, you know, I'm joined here with Pat. As I said, we've got a 21-member board and we have 2 business seats. And Pat is one of our business representatives. And one of the first places we started as an organization was really to look at the data, to understand the children who are in this space. When we talk about kids under 5, what do we mean by that? So we looked at our 2022 data. So in Montgomery County, there are 74,409 children who are 5 and under who live in our community. We believe, and the data shows us, that there are 40,711 children who are 5 and under who live below the self-sufficiency standard. And so this is a standard that is created and measured. The data is pulled together by the Community Action Agency, which is an organization within Montgomery County. And the self-sufficiency standard is the amount of income required for working families to meet their basic needs without public or private assistance. So it takes into account family composition, ages of children, and geographic differences in cost of living. So for 2023, the amount of $122,943 is what they determined to be the level for a family of 4 who has a preschooler and 1 school-age child. And so when we look at the data to understand children 0 to 5 who are being served by publicly funded or subsidized seats, we are serving 7,175 children. So this leaves us serving approximately 26% of the children 0 to 5 in our community who we believe qualify for and would need support through publicly subsidized seats. And so this really is our charge. And so Pat, I'll turn it to you. I know you wanted to talk a little bit about this piece and also the kindergarten readiness data that we look at as well.
Great. So thanks, Kimberly. Thank you, Anne, for letting us be here and present the things that are really bubbling in our own kettle here, so to speak. But before we get started, I wondered if we can just quickly go around the room and say something about what is your connection to ECE, which is actually our acronym for Early Care and Education. I've been surprised when I've talked to business owners that sometimes there's a bit of a disconnect. They'll say something like, oh yeah, that's not an issue in my business. But then I'll start talking to them as a human and they'll say, yes, my daughter has twins and she hasn't been able to go back to work. And, you know, it's so expensive. So what I'm wondering is, following my lead, I'll give my little personal introduction in a moment. But if you can just share 1 or 2 sentences about yourself and how you connect to this topic, I would really appreciate it. So for myself, I've lived and breathed business since I was married and back in the 70s, something like that, because my husband owns and operates Ruppert Landscape Company. And now that I've mentioned this, maybe you will notice that there are Ruppert trucks around the Maryland, DC, Virginia area. We have a large commercial landscape contracting company. But like I said, we've lived and breathed business our entire marriage. And so I come to Children's Opportunity Alliance to represent the business community. We have 4 kids and 11 grandkids. And so I've witnessed my own children struggle with what it is to have difficulties with childcare so that they can enter into the workplace more fully. So I don't know, Joan, would you go next?
Sure, I'll be happy to. I'm Joan McLaughlin. I work with Sodexo. I was formerly with Marriott, and I negotiated the first Bright Beginnings contract with Marriott to provide childcare. there at the headquarters, and my daughter was in one of the first classes. And, you know, I tell this story because I think we don't realize the impact of also bringing children into the workplace, child care facilities and workplace. My daughter told me she never doubted that women could work in corporations and be successful in corporations. She said, because I went to work with you every day, Mommy, and I saw you there. And I thought, what a great, you know, sort of add-on to the discussion around the importance of this. But my daughter now has a daughter, and she is 15 months. And so I see her trying to struggle with this. And I really do believe that it really is a win-win. Not only does it help families get back to work, but I think the importance of helping children have a fair start and helping them to have early education is important. So that's my story.
Thank you. Who would like to go next? Or if you're comfortable, I mean, I was a professor, I will call on you, but who would like to go?
I just want to give the chamber perspective. Brian Levine, Vice President of Government Affairs for the Montgomery County Chamber, worked with Montgomery Moving Forward. Gigi Godwin, our President and CEO, longtime advocate in early childhood education. I know that in my role as in government affairs, we are a strong advocate and have been for early childhood education and in other issues that are similar that affect we believe affect the business climate and the labor market, the workforce, and that's, you know, the cost of, not only the cost of childcare, but the quality of childcare. My kids are 9 and 11, so they sort of graduated from this section of the, but you know, we were lucky enough and to have the means to give them high quality childcare, and I think it helped them hit the ground running, entering kindergarten and elementary schools. So this is an important issue for the business community and the workforce. Thank you.
Thanks so much. Who else?
I'll jump in. This is Bill Wishman. Hi, Pat. It's really nice to see you in this presentation. Ann and I work together with Montgomery Moving Forward, and so that's where I really had a sharper focus on early childhood care and education, even though I also have I have college-age kids now, but they were young, and we were fortunate enough, like Brian, to have the means or whatever to have access to those types of services. But I also see it in the workplace as well with Kaiser Permanente. The challenges, and I feel as though we're one of the more progressive organizations, but people still have challenges. And then you look at the data, and you just see sort of the chasm between people who have had the benefit of early childhood care and education, and those who have not, and where they start in the education process, and the deficit that they have if they really haven't had this type of access to these services and so forth. And then I also see it from my sister's perspective, and she taught in this space in Connecticut, and now is an advocate for trying to really champion better access to early childhood care and education in the Northeast. And really the wages of the people who teach in this space are much, much lower than what you would find certainly in the public education space for K through 12. And so there's just a lot of issues that we have to deal with. It's not one thing or another, it's multifactorial. So I feel as though this is great just to get the awareness out. And Ann and I will be meeting with Montgomery Moving Forward later today, actually. So there's another opportunity to try to move forward and really develop opportunities to expand access to early childhood care and education. So thank you for this presentation.
Excellent. Thanks. Who's next?
I'll go. Hi, everyone. Good morning. My name is Teresa Ramsarup, and I work as a bank manager at M&T Bank. Childcare is extremely crucial and important to me. Without childcare, I cannot work. I cannot do my job. I have a 5-year-old and an 8-year-old, And my kids have both been in childcare since they were 3 months old. After maternity leave, I went back to work, and I'm very grateful to be able to have childcare. I also depend on before and aftercare, which is also important for my 8-year-old to be able to have a place to go to after school, and for myself to be able to leave work at 5:30 and pick her up at a reasonable time. As a manager, I work with the community as well, and I have many business clients who I manage, and it's a struggle for some of our business clients who cannot keep employees. They have like high turnover because of the employees not being able to have quality childcare, to be able to put your kids so that they can work and contribute to, the business, the economy. And also being in the public space, we have customers who comes into us for notary services. And some of those notary services entail us having to sign, notarize their signatures for forms from the subsidy piece, which I believe is the vouchers, the scholarships, and so forth. And just hearing your stories as to how difficult it is to navigate the system, and being able to get the right forms and send it to the right person, get it approved within certain times. They don't understand certain things, and I find myself like helping them through like the websites, and it is a little challenge as well. And I'm hopeful that this system can be easy to to help our applicants navigate.
Thank you. That
Thank
was
you.
wonderful. Yes. For the people who just came in, we're talking about what is our personal and business connection to the issue of the lack of affordable, high quality childcare. Mike, would you go next?
Yes, happy to. Morning, everybody. Thank you for putting on the conversation. Really appreciate it. I'm a commercial banker for Eagle Bank here in Bethesda, and my wife works full time for FEMA as well. And we have a 1 and a 3-year-old. So this topic is very important to us at the moment. So I'm looking forward to it.
Thanks for that. Really, where the rubber meets the road testimony. Who will go next?
Pat, I can go next. My name is Nishant. I'm actually in the process of opening up a childcare center by Shade Grove Hospital. I have 2 young daughters, so I understand kind of the importance of early childhood education. I joined, kind of wanted to understand the gaps and kind of where I can help as a provider and an owner. So yeah, I'm looking forward to kind of hearing from everyone and kind of better understanding where the gaps are and where I can help.
Do you have children, Nishant?
Yes, I have a 3-year-old and 4-year-old daughter. Little girls. So
Thank you. Who's next?
Yeah, I'll go. It's Cynthia Grissom. I apologize. I'm driving, so I'm not on camera. But anyway, I don't even know where to begin with this. I'm with WorkSource Montgomery, and so we're, of course, in the thick of workforce development and talent development for the county, and work regionally as well. And I'm thinking back to the days I've got kids who are one's about to graduate from high school, but I just remember having small children and just, you hate to wish time away, but I couldn't wait until they were school age, so I didn't have to worry so much about all this, the nanny and the childcare and the co-op situation we were in, and whether my husband was working or I was working, or it was just a huge juggle. And my kids were almost 5 years apart, so it dragged on. But we see people day in and day out because of what we do, and we are case managers for anyone and everyone. But a prevailing issue, of course, is childcare, with getting people into a suitable space to be able to work. Because when we enroll people in the program, which we pay for training, we pay for upskilling to get people into better wage jobs, we have to look at their eligibility. Of course, they've got to qualify for the program, but also suitability. And you have got to have your infrastructure down pat in order to be able to work. Transportation is a huge deal, and childcare is a huge deal. So we have referrals where we try to work with all these partners to make that happen for people, to get them in there. And we have stipends and support money for different things for a certain period of time, but can't solve everything. We don't have enough money for that, unfortunately. So that's a big one. And then we also worked on about a year and a half study for the county executive on caregiving and trying to solve that problem. And we finally had to break off childcare because we just thought childcare could be a whole study in and of itself. I mean, we also did the same for disability, but this was mostly focused on elder care. But they're all, they all suffer from a lot of similarities. So anyway, I am big supporter trying to get this resolved on a whole lot of fronts. And then I moved over to the Blueprint for Maryland's Future. So now I'm really in the whole youth realm now, focused on, K through 12, but right now it's mostly 6 through 12, but we'll get to the Ks. So anyway, big into it. Thanks for all you do.
Thanks for using the word infrastructure, Cynthia. How about, is it F. Halim?
Thank you. Hi. I'm sorry. I'll go ahead and put my video on. Good morning. I'm Fizi Halim. I'm with Montgomery College, Workforce Development and Continuing Education. I wanted to, I guess, offer, if there's the opportunity, to be able to help with both the training as well as the people that are graduating from the programs that we have here. So if there's an opportunity for us to be able to, set up job fairs or things like that, that might be able to help support organizations that are actually looking for qualified childcare workers, that might be something that we could help partner with. But in addition to that, I wanted to ask if there's anyone from the county that's actually, and Cynthia's associated with the county, but I mean, in terms of regulations, when I was with the county, I know that one of the reports that I was part of was actually putting together how complicated it is to get your childcare license. And so unfortunately, one of the issues of where to go, particularly for people who may want to do something in their home, and set up something. Nishant might be doing something that's outside of the house, in the facility, but there are people that are trying to set up childcare in their home. My granddaughter is in a home, absolutely wonderful facility that they've set up, and I have no problems with that, but I just want to make sure that we're coordinating all of your great efforts with the county's regulatory process as well, just to make sure that everybody's on the same page. So hopefully we can help along with Cynthia, how to get the people and how to train them, and then of course actually getting them set up and enough facilities available.
We'll talk more about that. This is a systemic approach. And yes, you've named important elements throughout the system. Thank you. How about Dennis Alexander?
Yeah, hi, my name is Dennis Alexander. I'm Director of Government Relations for Easter Seals. Operates 7 early childhood development centers and Head Start centers in Maryland, Northern Virginia, and DC. And we're planning on opening another in Hagerstown. Our CEO, John Horowitz, is also on the phone here. He might want to elaborate a little bit more on what we do. Our centers are inclusive centers, so we welcome all children in our centers and serve everybody that needs the service. I think the biggest issue that we see is that just the availability of childcare slots for folks that need the care. Access is one issue, and taking some steps in improving access for parents who have kids who need these kind of services, but they're just, frankly, they're just not enough slots to serve all these people.
Great. And then John,
I do not have any young children. All my all my kids are adults, but I did have kids, and I know back even when our kids were small, what a challenge it was to get care. So John, you want to?
Yeah, and I think you know, a lot of the challenge now is also keeping the sustainability of child development centers. You know, it's a very challenging time with the need to pay better, to have pay equity. But when we do that, it, you know, continually increases the cost of tuition, which is already out of reach for many families. You know, thinking through how people think about child development when they're not going into the office 5 days a week, but often, you know, working from home or doing different types of schedules. It's been a very tricky time in the sector to balance all these competing challenges. And, you know, now we're seeing a lot of families that had chosen to keep their children home while they worked from home, having big challenges with kindergarten readiness and not achieving the success that they had thought they would. So it's kind of trying to figure out where is the sector going to go and how do we make sure that we adapt to meet those emerging needs and keep it sustainable is, you know, why I wanted to join and hear what people are thinking about.
Thanks, John. How about Anne and then Mel? And I think we've got it. Is that right?
So
Anne.
this has been a topic near and dear to my heart. You know, from the time I was a new professor, trying desperately to figure out how to find support for my girls, to being a director of a school of public and international affairs, and having the #1 challenge in hiring faculty and keeping faculty being high quality, affordable childcare in the area, both in Blacksburg for Virginia Tech and also up in the National Capital Region. And now at the universities at Shady Grove, like my colleague from Montgomery College, you know, we, you know, not only do we support young people who want to move into this area, but also it's just foundational to the whole educational ecosystem and a successful educational ecosystem and talent development process. And 1 out of every 10 students in higher education are parents. And this is a huge barrier to people completing their degree or starting their degree or earning a credential. And so it's also foundational to the educational part of workforce development and talent development as well.
Thank you. And Mel, if you'll close us up.
Oh, okay. Well, like Feezy, I worked for the county government 25 years ago on the redevelopment of downtown Silver Spring. Right now I work for Lee Development Group, which is in downtown Silver Spring. So I've had a little bit of time with downtown Silver Spring, and John knows that I'm familiar with Easter seals. One of the things that I was aware of in the redevelopment project was the businesses we were trying to get to come here, the developers we were trying to get to build things here. They all had a common interest in providing childcare for the people who were going to work here. The businesses certainly needed it. The developers had a hard time figuring out how in the world they were going to do it. We did find some with Easter seals, and John has made a great success of that. Certainly at Discovery Corporation, they had a terrific daycare center, and Quality Time, a private school system here, has a very nice and successful daycare. They know what they're doing. I guess United Therapeutics is the latest one to come in and do that, but you'll notice that's only a handful. That's very few. So there's the thing that I noticed on the county side was we need more, and it's incredibly difficult to find people to do that. In fact, as you may remember, the Planning Commission, the Planning Board, was located in downtown Silver Spring. And when they sold their site to be developed, they didn't require that there be daycare on it. The people who really should have known about this and really forced the issue, they walked away. So I'm very, by the way, I should add the personal side. My wife retired as a librarian so she could go babysit for my daughter, so she could go to work.
Thank you. And Mel, that was great. And I'm guilty of having forgotten Brittany. Britt, can you weigh in?
Oh, yes. You know, I feel like this is a little bit of a, I'm a plant in the audience, maybe. I don't know if you can hear me. I work at Children's Opportunity Alliance with Kimberly and Pat. And I just have to say that this is such an important, issue for the entire county, state, nation. You guys have already said that 90% of brain development, social, cognitive, and emotional, happens before the age of 5. So the correction that we're having to do in the workforce around supports for people entering new positions or changing positions, no matter the age you are as an adult, it does show up in terms of the whether or not you've had quality childcare, early care and education in that 0 to 5 space at that time frame. So you are backtracking to look at trauma, you're backtracking to look at how people relate to others in the office environment, how people excel and grow in their jobs to leadership positions. So that is what I think is so important, and probably has already been mentioned here on this call, but wanted to bring that to light as well. Thank you.
So thoughtful. Thank you. Nakia Harper, I think you just entered the room. We're still kind of introducing ourselves to each other and explaining what is our personal connection with the issue of lack of high quality, affordable childcare.
Interesting. Hi, my name is Nakia Harper. I'm with Kid Museum here in Bethesda. Nice to meet you all. We do educational services primarily related to STEM education for K through 12. I really just was interested in understanding kind of what this workforce development conversation was regarding, as we obviously focus on young learners and primarily those who are under-resourced in our community.
And do you have kids? That's such
I
a personal question. I'm sorry.
I do have children. Mine are a little older though, so I'm not personally in the childcare scenario, but totally understand the cost factors involved with it, really at a young age. So.
Thank you. Well, then I'm going to turn it back over to Kimberly. Thanks for sharing those connections to the topic at hand. As I said, I was so surprised. I was talking to this big employer in Montgomery County, and he was telling me, yeah, it doesn't really matter to him or to his workforce. But then as soon as he mentioned his grandchildren, wow, it really mattered. So I appreciate the personal connection. Kimberly, back to you.
Yeah, and just to that point, I will share just short my personal connection. So I am a mother. I have 3 kids, 11, 9, and 1.5. So while I had a pause or a break slightly from childcare, we're now back in it. And yes, we've been in all different types of locations: family childcare, large centers, small centers. So definitely kind of, I don't claim to be an expert in early care and education, but I'm a parent, and that is what has made me an expert in this space, is going through it as a parent and really trying to understand the system. So, so I'll go back to sharing my slides. Can everybody see?
Yes.
Okay. So where we left off with the slides was talking about the percentage of children being served in our community who we believe are families who are struggling to afford quality early care and education. And so the other piece, just a data point to throw out there, and there's further information on our website around kindergarten readiness. That topic came up as people were doing introductions. But just want to raise, only 44% of children in Montgomery County demonstrate kindergarten readiness. I think when I started talking about that data point more widely in Montgomery County, everybody kind of looked at me and said, no, that's not us. That's DC. That's Prince George's County. And I said, no, this is us. And when you break down that data by other different subcategories, you look at special populations such as students with disabilities. Only 15% of students with disabilities are demonstrating kindergarten readiness. You look at multilingual learners, only 12% of those children entering kindergarten are kindergarten ready. Our Black and Brown children, 38% of Black children are kindergarten ready. 23% of Hispanic children are kindergarten ready. So there's further data and information on our website that if you want to look at some of that data, please feel free. But it is interesting. I think it's good for us to raise awareness around that. But so to get back to the Children's Opportunity Alliance, so we really are focused on community-wide solutions. We are working on these 4 areas that we want to see results in our community around ensuring that families are meaningfully engaged, that there is seamless access to high quality programs, that we are fully prepared and supporting the workforce to support this important work, and that we are coordinating and resourcing this very important system. And John, you hit the nail right on the head. You know, there's been a lot of talk lately about pay equity, and that's great if we want to push for pay equity, but it increases the cost of care. And pay equity definitely addresses the challenges in the workforce, but it doesn't address the access and affordability for parents. So again, if we are taking a systems approach, we have to think about how all of these different pieces impact each other. As we make an investment in one part of the system, we have to understand the ripple effect that it's going to have on the entire system. And so we are working this spring on building out what is called a common agenda. And so the work that we will be doing will kind of fall into these 6 buckets in this visual on the left of sharing information, really working to boost resources into the system, leveraging data and looking at data, supporting research and innovation, driving advocacy, both at the county level and at the state, and really making sure we are collaborating and working with partners. Coordination is a key part of this. We do not believe that we can do all of this work or that we have all the answers, but we do believe in the brilliance of our community. And we believe there's a lot of bright spots and people and committed organizations and partners in our community that when we pool all of our resources and time and effort together, we can help to collectively work on improving our system in our community. So that's a little bit about us. And when we talk about this as an economic imperative, here are a couple different points. Pat, do you want to share the first one? Oh, you're on mute.
Sure. We all know it's just out of reach for most of us. And so childcare and pre-care are expensive. It's more than what families spend on their home mortgages, for instance. So let's see, it's 27% of the household income. I think that says it. Thank you.
And yeah, the complementary statistic to that is, you know, an average family spends 22% of their household income on housing. So childcare is more expensive than their housing. Secondly, this gets to the return on investment. So there's a 13% return on investment for birth to 5 programs. And that gets to kind of the point Britt made about all this brain development that is happening in those early years and how important it is to invest in that space. And then Pat, do you want to share the last one?
Sure. The absence and turnover of working parents. This was quite a topic in the State of the Economy report from the Comptroller of Maryland for last year. And the fact that Maryland is one of the bottom 6 states for women to return to the workforce after the pandemic. So that costs our employers a staggering $2.4 billion. It's definitely an economic issue.
So I'm just curious, with all of you here, does the phrase talking about early care and education as an economic imperative Does that resonate with you? And is that an easy talking point for you to use as you talk with your business colleagues and networks about why this is an important issue for us to think about as a community? Don't everybody speak at once.
I think so, but you're probably preaching to the choir with me.
I mean, we'll transition and move on to the next slides, but I think, part of what we are hoping for from this conversation is to really help businesses and you guys all spoke about it, but to talk about how businesses can be involved in this. And Mel, you spoke about it very clearly in terms of thinking about, local redevelopment and businesses wanting to come to the community and ensuring that there's childcare available because they know that's going to be part of what their workforce needs. And so how do we raise that awareness and empower you all to be able to talk more to your business networks and communities about how important this is? So I'll go back to sharing my screen and we'll share with you guys some examples of what some other communities have done in terms of how to really engage business in this early care and education space. So one option is to be a member of the Alliance's Business Advisory Group. We are looking to start this spring, and we would welcome any of you to join this advisory group, or if there are other folks in your community or your network that would be interested in this topic, we would love to pull that group together and talk about solutions and really help us to move this work forward. A second option is to donate to the Children's Opportunity Alliance. We are a new nonprofit, and we really are looking at the long-term systems level outcomes and tracking the data and ensuring that we are positively impacting the system and structures. A third opportunity is to connect with your state and county elected officials and express to them the importance of investing and expanding early care and education in our community. Fourth, and this is a more personal one, examine your role in supporting your employees and within your organization around accessing affordable childcare and pre-K programs. And then lastly, really to keep in mind that early childhood investments now will save money in the long run. So those are just some ideas. We have some examples to share. Pat, did you want to ask one or two questions before I move on to the next slide and share some other examples?
Yes, I'm chomping at the bit here. Thank you. So of those 5 bullet points, Kimberly, I think you make a really excellent point that what we're trying to do through this talk right here, right now, is not to convince you, because like John Horowitz says, this is the choir that's assembled here right now. But we want to empower you to talk to the business people that you encounter throughout your business lives. So that being said, is there one of those bullet points that jumps out at you and you think, yes, I can do that? And if it's bullet point number 2, that's really great. Give voice to it. But if whichever bullet point it is, could just, 3 or 4 of you say, yes, I can see myself doing this. Mike, how about you?
I feel that a lot of the businesses that I interact with are, to be honest, just kind of like struggling to survive right now. And so this, while I'm sure they think this topic is important, they just don't have the bandwidth to handle it unless it's simplified and kind of handed to them on a silver platter, and so they don't really have to put much time into it because they just can't afford to. I think until businesses get to a big enough size and scale, that's when they can afford to put resources towards this topic, unfortunately. I think that's a problem, because I like I said, I'm going through this right now, and it's been tough navigating with my wife and I, given that we're both working, we're both commuting to the office every day. And you know, thankfully we have the ability to put both of our boys into daycare, but it's still a struggle. And we know it's a struggle for most of the folks that we interact with and we talk with. But from a business perspective and from the, you know, our clients and our prospects that we interact with, I think it's important to bring up, I think just having the ability to simplify it for them so that they can pass that along to their employees and to the folks that they're trying to hire. The extent that we can simplify it, the better. I think that's key here from my perspective. Hopefully that makes sense. I was kind of rambling there.
That's great, Mike. I hear you, and I wonder if bullet point number 3, honestly, if we had a meeting with Dawn Lutke on the Montgomery County Council, and we asked her point blank, are you hearing from parents that childcare is impossible? And it is a simple matter to Google who is my council member, and then write a note to that, an email to that council member and say, childcare is impossible. Can you please do something about it? And if that's an action that you could take only because you've been to this particular forum, this discussion, it would make a difference. Because then we at Children's Opportunity Alliance, who are taking this systems approach, we can say, Dawn, are you hearing from your constituency that childcare is an issue? And she could then say yes, but she has said no. So it's those kind of, please speak. So thank you, Mike. I appreciate that. Will someone else weigh in on one of those bullets that you could actually see yourself doing?
Well,
Mel, go ahead. Yeah.
Is that asking people to put an unbearable burden on somebody like Dawn or the other council members? Because it seems to be awfully hard these days to even figure out what we're looking for in the way of this changes in the system. We want more education. I think more education for the teachers and certification is already a state requirement that's driving the cost of this way beyond the stratosphere. We want playground areas and such, which made it almost impossible to do in an urbanized area like downtown Silver Spring, where the people are coming to work and they need a place to drop their kids, where they live and they need a place to drop their kids before they drive off to work or run to the subway. We have put up and are continuing to put up barriers. And maybe the first thing we need to look at is, before telling Dawn how bad the burden is for the parents, the burden for anybody who tries to do childcare. Can we define what we actually want and make it doable?
Mel, so I think bullet point number 1 has your name on it.
Well,
how about one? Yeah, go ahead.
Can I just follow up to that though, Mel? I think part of also what the Children's Opportunity Alliance is doing is following what's happening with the Blueprint Pre-K and other things at the state level, and advocating and submitting testimony and encouraging community members to advocate and submit testimony. Because though there are a couple bills that are going through the House or through legislative process this year that are reducing the certificate requirements for teachers, pushing it back, you know, to year 3 or 4 or 5 of implementation so that we can get more kids in care now, because we do believe kids are in quality, or that quality programs exist, but the workforce doesn't necessarily meet the requirements that are in the blueprint. So part of our work as we take this systems level approach is looking at what are some of those requirements that are in place and asking just those questions, right? Do we really need to have this requirement now? Is this going to help us get to our end goal? Or are there other pathways or alternative certificates or other things that we could use that would help us better use the system as it exists currently?
Well, as you pointed out earlier, people who work in this system, probably except for at Easter Seals, but the pay is too low.
Yes.
And it's always been my impression that when you increase the pay, the cost of childcare is going to go up. And are we into a spiral there that's going to break the back? And I don't see a way out of it.
Yep. And I think that's where, as we take a systems approach, we have to think about how making an investment in one space impacts the rest of it. And I think that's the concern with expanding pre-K only, is that the business model for childcare centers and even family childcare businesses depends upon having both preschool age students and infants and toddlers. So if we're expanding only pre-K and asking for all of these pre-K seats, we also need to think about then what happens to our infants and toddler seats. And right now, most of our pre-K seats are in the school system, which is not how this is going to happen. It's going to be a mixed delivery system. But how do we track with data over time on an annual basis how many seats are in the community, how many seats are within the school system, so that we're making equal investments into both sides of the mixed delivery system, so that the childcare businesses are able to still, survive and thrive. Pat, I don't know if you wanted to ask one more person to share something, or if we want to move on to the examples. I defer to you.
Thank you. Am I on mute?
No, you're good.
Joan, can you weigh in on one of these bullet points that makes sense to you that you could actually see yourself doing? Even if it's the fifth point, which I hope everybody does.
Excuse me, sorry. I definitely actively participate in number 4, supporting our employees around accessing affordable childcare and pre-K programs. My own kids were in childcare, and I definitely needed that flexibility and some to be able to really be able to pick them up, drop them off, have find accessible childcare near where I worked. And I certainly encourage all working parents to do that and take the time they need, the flexibility they need to do that. I think I could also do number 3. I think this is also an extremely important issue. Unfortunately, it's a very complex issue, but I do believe when you look at the return on the investment and the long-term return on the investment, it's not one that we can continue to, kick the can down.
Great, thank you. By the way, Joan, with respect to Sodexo, is that how you say it?
Yes.
Okay.
Yes, good for you.
I was just talking with City of Gaithersburg the other day about how Sodexo is moving out of Rio.
Right.
And that there are opportunities in existing retail and office space that could provide settings for childcare seats. And so that's a conversation that, because you're here today, I'd like to circle back with you and talk about how we can actually get physical space dedicated in some way to our issue of the lack of affordable, high quality childcare. So thanks for sharing that story.
Yeah, so Sodexo actually does provide childcare services in Europe. We actually don't do it in the US, but I understand what you're saying about finding space in our headquarters and building. But yes, let's have that conversation.
So maybe you could also think of bullet point number 1.
I knew we were going to get to that. I knew it was going to that.
All right, Kimberly, quick, next slide.
Before you commit too many people, Pat. Here are 2 examples, and Mike, I think this example of the Hope Starts Here kind of is a good example of something that is a kind of a ready-made business advisory kind of kit. So Hope Starts Here is Detroit's early childhood partnership, and they created this toolkit, which has emails for employees to do outreach, to talk with them about childcare challenges or how they're supporting their employees, emails for business partner outreach, social media materials, draft blog posts for companies on their blog or internet, other visual video assets, data points of what is the need in Detroit. So we are kind of thinking about doing a similar type toolkit here that would hopefully help local businesses. I know Montgomery Moving Forward did a toolkit a few years ago, so hoping to build upon that and reframe that and refresh that so that hopefully businesses would have something more ready-made, to your point, that they could then feel like they could be empowered and be able to do something in this space. The other example to share, which I think is a really unique one and has actually now started in Michigan, but has now expanded to New York, North Carolina, Kentucky, and Virginia. It's called a tri-share model. And so the cost of an employee's childcare is shared amongst the employer, the employee, and the state of Michigan. And it's coordinated by this Michigan Tri-Share Facilitator Hub. So to this idea that we know the cost of care is expensive, how do we think about who are the partners who are invested and interested in having access and supporting the workforce in order to have their employees be able to have access to quality care? It's an interesting model for us to think about. And so these are the types of things, as we are thinking and dreaming about this business advisory group, that we'd like to bring some of these ideas to the table and say, what do you think would work best in our community? What are some of the easier things for us to start more immediately? And then what are some of the mid or long-term goals that we could work on in partnership with the business community in Montgomery County? So I want to close out today by sharing with you all, we have a business breakfast coming up on Thursday, April 11th. This week in April is the Week of the Young Child, which is a national awareness raising week that is sponsored by the National Association for the Education of Young Children. And so we are holding a business breakfast, and we would like to ask all of you to think of 2 or 3 members of your kind of business network and community that you would like to invite to this conversation on Thursday, April 11th, so that we can continue this work moving forward and continue to spread the word about this major need in our community. Pat, did you want to say anything else in closing?
Yes, thank you. So if you look at the bottom picture on that invitation, it's a building getting erected. It's got a crane. Every time we pass a crane, my husband stops and says, "Okay, whose name is on that crane?" I mean, it's that kind of engagement with the business community that I've had my entire life, and I pushed for that picture. I overheard my husband say that I'm passionate, that his wife is passionate about children, and that's why I do this work. And I got furious with him. I said, "Craig, that's not how you should present who I am and what I'm trying to do. I'm not passionate about children. I'm passionate about economic vitality. I'm passionate about communities." So when you say you're passionate about children, it's like, oh, here's this, privileged little grandmother lady who wants to go rock babies. And I like babies. I mean, babies are fine. But to me, this is a much more integrated issue. And so our breakfast came out of the idea. I don't know how many of you know about the Lake Forest Mall redevelopment. Anybody here in the room know about that? Mel? Okay.
I'll raise my hand.
A couple of us, well, a bunch of these defunct shopping centers, we no longer have retail because of Amazon. We no longer have, offices because of Zoom. I mean, that is an exaggeration. I know, but these developers are coming in and they're repurposing old shopping centers, and we need to get in the DNA of these shopping centers and these re-envisioned spaces and say, we have to have childcare. It's not just housing, affordable housing, and it's not just jobs. It's affordable, high quality childcare that truly builds a vibrant community, a vibrant economy. So I'm hoping that every one of you will consider coming to this event. It's just breakfast, for instance, Mike, so you can come, and have a cup of coffee at the Holiday Inn in Gaithersburg and leave at 9:30 and be done. But I'm hoping that if you would like this invitation, you'll put your email in the chat. And if you can possibly bring other businesses to the table. This is our first foray into gathering as many business voices as possible. We have a representative from the Comptroller of Maryland's office is coming, Ben Siegel, who is a deputy comptroller, and Joy Moore, who is the mother of Governor Moore. She works with vulnerable families, and she's going to come and be part of the discussion. But we really wanted to focus on people who are in the workplace, who have small kids, who are or know such people and would like to have this issue solved. So if you can put your name in chat and your email address, we really appreciate it. It'll be a conversation similar to this, although it will be lively, I will tell you that. And we hope that you would come and that you would bring other people in your business network to it. All right, Kimberly, back to you.
No, great. Thanks, John. I saw you put your email in the chat. We'll make sure to send this to you. But just want to close out, by saying thank you. And, really want to go back to that fifth bullet on our list of things you can do is, do keep that in mind. These early childhood investments now will save us money later. And so how do we collectively work together to advocate for this change we want to see in our community? And work together to better serve the children and families in our community. Many of our neighboring states, Pennsylvania, DC, Virginia, have figured this out already and are already serving larger percentages of their 0 to 5 population. And so we are falling behind. And so there really is a need for us to think collectively, work collectively, and push this work forward. And we feel a sense of immediacy and urgency behind this. So we hope you've learned something today. We hope this has inspired you and that you will, continue to stay connected with us and help us in this cause. So thank you all for your time today.
Can I ask just one quick question?
Yeah.
Could you please take language as part of the discussion items that you're talking about, because we are such a diverse community. Unfortunately, I feel that language may be an inhibitor for many people that either one are afraid to put their children somewhere because they don't know whether the child will be able to communicate or understand if they are able to talk yet, or they won't be able to understand. So I'm just suggesting that might be a discussion topic as well.
Okay. No, that's great. Thank you for that feedback. We appreciate it. Any other questions or comments before we close out, Brian? Otherwise, I'll hand it over to you or to Anne, who.
I'll just weigh in to say, first of all, thank you for this talk. I really appreciated the deep engagement with the people who were here. I think this was very helpful. It's a good start to a conversation. I think the business community in Montgomery County is phenomenal and is deeply passionate about community and about the quality of life here. And so I think we have an incredible business community that can really help move this forward and to see the urgency of it as well. I'm just going to put this in a frame of reference. You think back a couple of decades when something like drinking and driving was considered a personal driving offense, right? Or when smoking was considered a personal choice. and how over time those became public issues that we invested in deeply, and they were completely reframed as, you know, public health issues, as something that we all had a stake in. And I think that with the help of the business community, we can reframe childcare as something that families have to worry about or moms have to worry about, to something that we're all deeply invested in. And our overall success as a community and state rests on trying to figure this out. So I just really appreciate the work, Kimberly and Pat, that you're leading. This is hard work, but I know that you've got some great allies here in the business community to help move this forward. So I just want to say thank you for the way you led this discussion today and for your effort as well.
Thank you, Anne.
Brian, back to you.
Yeah, any other questions or comments, dialogue with Kimberly and Pat while we have them? Okay, just wanted to make sure. Yeah, on behalf of the Montgomery County Chamber, thank you, Kimberly and Pat, so much for your time and for leading such an engaging discussion on one of the Chamber's priority issues, which is early childhood education and childcare. If you go to our website and check our policy priorities for local and state policy priorities, you'll see 3 legs of the stool. One of them is talent and workforce as a priority issue, and under that we have a few bullets, and one of the 3 or 4 bullets is exactly that. It's EC and childcare. So we appreciate you bringing this, talking more about the Children's Opportunity Alliance, and bringing these issues to our attention, or at least having a dialogue about them. And I've learned so much today. So thank you on behalf of the Chamber. And with that, everyone have a great rest of the day. Have a great Wednesday. Thank you, everyone.
Thanks, everybody.
Bye.
Thanks.